I can just use my digital impression camera because it has the ability to take colored 2D photos like an intraoral camera. We hear that objection all the time. Here's the challenge with that. A couple of things. One, you don't have multiple digital impression cameras. In a busy practice, most hygienists are not going to get up and go find much of anything, especially when they don't have to. Had an assistant one time tell me, well, I have to get up and go get my sensor. You do, because you can't do dentistry legally without the sensors and the x-rays. Therefore, you don't have to get up and go get the intraoral camera or the digital impression device. Most of the time, you won't. So, in taking that digital impression camera image, I just did this with the 3-shape camera. It's tough. It is. It's tough. And to get a crystal clear image, because that's what we're going for in connecting with the consumer in the chair, you're not able to get what's really going to connect with patients in that ease of use and image quality that we're going for in hopefully in your practices. So that's the main reason why is you're just workflow and image quality are just not there. And if it's not next to them, less likely, far less likely, I would even venture to say they are not going to get up and go find something that was going to add time to their day and to use it.